Paracetamol is one of the world's most commonly used medicines. But did you know that even this common painkiller can cause side effects? Here's what you need to know, and when you should seek medical help. Paracetamol is commonly used to reduce fever and relieve mild to moderate pain. When taken at the correct dose, paracetamol is generally safe. Within about 30 to 60 minutes, many people begin to feel relief. Most people experience no side effects when using paracetamol correctly. Some people may feel mild nausea or stomach discomfort. A mild skin rash can occasionally occur. Rarely, some people develop an allergic reaction. Difficulty breathing is a medical emergency. Taking more than the recommended dose can seriously damage your liver. An overdose may not cause symptoms immediately, but liver damage can already be happening. Early signs include nausea, vomiting, sweating, and loss of appetite. Later symptoms may include severe abdominal pain and yellowing of the skin. Drinking alcohol while taking large amounts of paracetamol increases the risk of liver damage. Always check medicine labels because many cold and flu medicines already contain paracetamol. Never exceed the recommended daily dose. Children need the correct dose based on age or weight. Paracetamol is often considered a preferred pain reliever during pregnancy, but it should still be used only as directed by a healthcare professional. Seek medical attention immediately after a suspected overdose, even if you feel well. Also seek urgent care for trouble breathing, swelling of the face or throat, or severe allergic reactions. Take only the recommended dose, follow the instructions on the label, and keep medicines out of children's reach. Paracetamol is safe for most people when used correctly, but knowing the warning signs can protect your health. Follow PharmaWise for trusted medicine advice.